There is something sitting in your kitchen spice cabinet right now that has been used as medicine for over 2,000 years. Ancient Chinese physicians prescribed it. Ayurvedic healers built entire treatment protocols around it. Medieval European doctors used it to fight infection at a time when they had almost nothing else. And today, modern science has confirmed what those ancient practitioners somehow figured out without laboratories or clinical trials, that this tiny, nail-shaped spice contains some of the most potent bioactive compounds ever studied in nutritional medicine. I am talking about cloves. And here's the thing that is going to change how you use them forever. Most people are using cloves in a way that destroys somewhere between 60 and 70% of their active compounds before those compounds ever reach the bloodstream. They are making simple, fixable mistakes in how they prepare, combine, store, and consume cloves, and as a result, they are getting maybe a fraction of the benefit they could be getting from something that costs almost nothing and is already sitting in their home. Stay right here, because by the end of this video, you are going to know exactly what those mistakes are and exactly how to fix them. Welcome. If you're new to this channel, this is Dr. Alex Morgan, Aging Wellness Lab, and what we do here is take real, peer-reviewed science about nutrition, aging, and natural health, and translate it into practical information you can actually use in your daily life. If that is the kind of content you have been looking for, hit subscribe right now and give this video a like. It genuinely helps this information reach more people who need it. And today's topic is one that I think a lot of people have been getting wrong for a long time without realizing it. Now let's get into the real substance of what cloves can do and how to use them correctly. Let me start by giving you the full picture of what you are actually dealing with when you pick up a clove. A single dried clove bud contains over 30 different bioactive compounds, but one of them stands so far above the rest that it deserves its own introduction. It is called eugenol. Eugenol makes up somewhere between 70 and 90% of the essential oil content in cloves, and it is one of the most extensively studied natural compounds in pharmacological research. The scientific literature on eugenol is not small. There are thousands of published studies examining its effects on inflammation, microbial activity, blood sugar regulation, liver function, neurological health, and even cancer cell behavior. What emerges from that body of research is a picture of a compound with genuinely remarkable biological activity, one that works through multiple mechanisms simultaneously in a way that very few pharmaceutical drugs can match. Eugenol is a potent inhibitor of an enzyme called cyclooxygenase, or COX. If that name sounds familiar, it is because COX inhibition is the exact mechanism through which ibuprofen and other non-steroidal anti-inflammatory drugs reduce pain and inflammation. Eugenol essentially does what ibuprofen does. It blocks the enzyme that produces prostaglandins, which are the signaling molecules that drive inflammation. But eugenol also has antioxidant properties, antimicrobial properties, and the ability to modulate blood sugar that ibuprofen does not have. It is a remarkably multifunctional molecule, and it is sitting in your spice cabinet at this very moment. But here is where the problem begins, and this is the core of everything we are talking about today. Eugenol is a delicate compound. It is volatile, meaning it can evaporate. It is sensitive to heat. It is sensitive to oxygen exposure. It is sensitive to light, and it degrades when improperly combined with certain foods and liquids. Most people, when they think about using cloves for health purposes, either grind them into powder and add them to hot beverages, boil them in water, or buy pre-ground clove powder off the shelf and sprinkle it into things. Every single one of those approaches, done incorrectly, significantly reduces the bioavailability and potency of the eugenol and other active compounds. Let me walk you through each mistake one by one, and then give you the right approach for each situation. The first and most common mistake is using pre-ground clove powder from a container that has been sitting open on a spice rack for months. This one hurts me to say because I know how many people have a jar of ground cloves that they bought a year ago, opened twice, and left sitting in their cabinet. Ground cloves have a dramatically accelerated rate of volatile oil loss compared to whole cloves. When you grind a clove, you rupture the cell walls and expose the internal oil glands to oxygen and light simultaneously. The eugenol begins evaporating and oxidizing immediately. Studies on essential oil degradation in spices show that ground cloves can lose up to 40% of their volatile oil content within the first 3 to 4 months after grinding, even when stored properly in a sealed container. If that container has been opened repeatedly and stored in a warm, bright kitchen, near the stove, near a window, the loss is significantly faster and more severe. The solution here is straightforward. Buy whole cloves and grind them yourself immediately before use. A small coffee grinder or spice grinder works perfectly. Grind only what you need for that day. The difference in aroma alone is striking when you grind a fresh whole clove versus opening a jar of pre-ground powder that has been sitting around. That difference in aroma is not just sensory, it is a direct reflection of the eugenol content. More aroma means more volatile oils still present. Less aroma means the active compounds have largely escaped. The second mistake is something almost everyone does, and it is counterintuitive because it feels like you are doing something healthy. People boil cloves in water to make a tea or a decoction, keep the water at a rolling boil for 10 to 15 minutes, and then drink it thinking they are getting a concentrated dose of cloves benefits. In reality, prolonged high heat is one of the fastest ways to destroy eugenol. Research on the thermal stability of eugenol shows that sustained temperatures above 100 degrees Celsius, which is exactly the temperature of boiling water, cause significant degradation of the compound. The longer the exposure to that heat, the more eugenol is lost. Additionally, boiling causes volatile oils to literally steam off into the air. That is why your kitchen smells like cloves when you boil them. The smell is the medicine leaving the pot. The correct approach for a clove infusion, if that is how you want to consume them, is to bring your water to just below a boil, somewhere around 85 to 90 degrees Celsius, which is the temperature where you see gentle wisps of steam rising from the surface, but the water is not yet bubbling. Pour that hot water over 2 to 3 whole or lightly cracked cloves. Cover the cup immediately with a small plate or a lid. This is critical because it traps the volatile oils that would otherwise escape with the steam. Let it steep for 8 to 10 minutes covered, then consume it relatively quickly rather than letting it sit and continue releasing volatiles into the air. This approach preserves a significantly higher percentage of the active compounds compared to boiling. The third mistake involves something that surprised even me when I dug into the research: the combination of cloves with dairy. Many traditional recipes and health drinks combine cloves with milk, cream, or other dairy products. And while this is culturally common and certainly not dangerous, there is evidence that certain proteins in dairy, particularly casein, can bind to phenolic compounds like eugenol and reduce their absorption in the digestive tract. The dairy proteins essentially wrap around the phenolic molecules and limit their bioavailability. It is a similar phenomenon to what happens with the antioxidants in green tea when combined with milk, a topic that has been studied quite extensively. This does not mean you can never combine cloves with dairy. It means that if you are consuming cloves specifically for their therapeutic benefit, consuming them separately from dairy gives those compounds a cleaner path into your bloodstream. The fourth mistake is one that most people would never think about, and that is the timing of clove consumption relative to other foods and habits. Eugenol is a fat-soluble compound, which means it is absorbed more efficiently when consumed alongside dietary fat. Consuming cloves or clove-infused preparations on a completely empty stomach with no fat present reduces their absorption. A small amount of fat, even just a teaspoon of coconut oil stirred into a clove preparation, or consuming cloves with a meal that contains healthy fats, significantly improves the uptake of eugenol into your lymphatic system and from there into circulation. This is the same principle that governs the absorption of fat-soluble vitamins like A, D, E, and K. They need fat present in the digestive tract to be properly absorbed. At Dr. Alex Morgan, Aging Wellness Lab, we consistently emphasize that bioavailability, how much of a nutrient actually makes it into your bloodstream and tissues, is just as important as the nutrient itself. You could be consuming theoretically therapeutic quantities of a compound and getting almost no clinical benefit because you are not absorbing it effectively. Understanding and optimizing absorption is one of the most underappreciated elements of nutritional health. Now let me tell you something about the storage of whole cloves that most people get wrong even when they are doing everything else right. Cloves should be stored in an airtight glass container, not a plastic bag, not a loosely sealed spice jar, not an open dish. Glass is less permeable to oxygen and does not leach chemical compounds into the spice the way some plastics can over time. The container should be kept in a cool, dark location, a drawer, a closed cabinet, away from the stove and any heat source. Light and heat are the two primary accelerants of eugenol degradation in stored cloves. Whole cloves stored correctly in glass in a cool, dark place can maintain their volatile oil content for up to a year or more. Stored incorrectly, they can lose significant potency in a matter of weeks. Let me now shift into the actual health benefits that you are preserving when you use cloves correctly, because I want you to understand what is at stake here. This is not just about flavor or tradition. The research on what properly consumed cloves can do for the human body is genuinely impressive across multiple domains of health. Starting with blood sugar regulation, this is one of the most robustly studied benefits of clove consumption. Multiple human clinical trials have examined the effect of clove supplementation on glycemic markers, and the results show consistent improvements in fasting blood glucose, post-meal blood sugar spikes, and insulin sensitivity. The proposed mechanism involves eugenol's ability to mimic insulin's effect on glucose uptake in cells and to inhibit certain digestive enzymes that slow the breakdown of complex carbohydrates. For anyone dealing with insulin resistance, prediabetes, or type 2 diabetes, or for anyone who simply wants to keep their metabolic health in good shape as they age, the daily inclusion of correctly prepared cloves in the diet is something worth taking seriously. Then there is the anti-inflammatory effect, which we touched on earlier with the COX inhibition mechanism. Chronic low-grade inflammation is now understood to be one of the primary drivers of virtually every major age-related disease: cardiovascular disease, Alzheimer's disease, type 2 diabetes, osteoarthritis, and many forms of cancer. Anything that meaningfully reduces systemic inflammation reduces risk across all of these conditions simultaneously. Eugenol's anti-inflammatory activity is dose-dependent and has been demonstrated in multiple in vitro and in vivo studies. It is not as fast or as strong as pharmaceutical anti-inflammatories at equivalent doses, but it does not carry their side effects, and when consumed consistently over time, it contributes meaningfully to the body's overall inflammatory burden. The antimicrobial properties of cloves deserve particular attention right now in an era where antibiotic-resistant bacteria are a growing public health concern. Eugenol has demonstrated significant activity against a wide range of bacterial strains, including some that have developed resistance to common antibiotics. Studies have examined its effectiveness against Staphylococcus aureus, E. coli, Salmonella, and a number of other pathogens. It also has antifungal activity, with particular effectiveness documented against Candida species, the family of fungi responsible for yeast infections and oral thrush, which are common in older adults and in people who have taken repeated courses of antibiotics. Consuming cloves regularly creates an antimicrobial environment in the oral cavity and digestive tract that can meaningfully reduce the burden of problematic microorganisms. The liver protective effects of cloves are something that I find particularly compelling, and they are not talked about nearly enough in mainstream health content. The liver is the body's primary detoxification organ, and it takes a significant biochemical beating every day from environmental toxins, processed food components, alcohol, medications, and the natural byproducts of metabolism. Eugenol has demonstrated hepatoprotective effects in multiple animal studies. It reduces liver enzyme levels that indicate cellular damage, it suppresses inflammatory pathways in hepatic tissue, and it appears to support the liver's own antioxidant defense systems. While human trials specifically on cloves and liver health are still somewhat limited, the mechanistic data is strong enough that this is an area of active and growing research interest. Now I want to address something that is important for safety, because we always give you the complete picture at Dr. Alex Morgan, Josh Aging Wellness Lab. Cloves are powerful, and like any powerful substance, they have a context in which they should be used thoughtfully. Eugenol, in very high concentrations, far above what you would get from dietary use, can be hepatotoxic, meaning it can cause liver damage rather than protecting it. This is primarily a concern with concentrated clove essential oil, not with whole cloves or ground cloves used in culinary quantities. But it is worth knowing. The therapeutic sweet spot for cloves is 1 to 2 whole cloves per day, cracked or lightly crushed to release the oils, but not heavily processed or consumed in enormous quantities. More is not always better, and this is a case where staying within a reasonable dietary dose range gives you the benefits without any risk. People on blood-thinning medications like warfarin should also be aware that eugenol has mild anticoagulant properties and can potentially enhance the effect of those medications. If you are on any anticoagulant therapy, discuss adding therapeutic amounts of cloves to your routine with your physician before doing so. Similarly, people with bleeding disorders should exercise caution. These are real considerations, and responsible health communication requires mentioning them. Let me now give you a practical daily protocol that incorporates everything we have discussed, because I want you to leave this video with something actionable. In the morning, take 2 whole cloves and lightly crack them. Not grind them fully, just crack the outer surface with the back of a spoon or with your teeth, and place them in a cup. Heat filtered water to just below boiling, around 185 degrees Fahrenheit if you have a temperature-controlled kettle, or simply let boiling water sit for about 90 seconds before pouring. Pour the water over the cracked cloves, cover the cup with a small plate immediately, and let it steep for 8 to 10 minutes covered. While it steeps, prepare something with a small amount of healthy fat. A few almonds, half an avocado, a teaspoon of coconut oil stirred in, so the fat-soluble eugenol has a vehicle for absorption. Drink the infusion warm, not scalding, and consume it separately from any dairy products. Alternatively, if you prefer to consume cloves with food, add freshly ground whole cloves to oatmeal, smoothies, or savory dishes at the end of cooking. Not at the beginning, because prolonged heat exposure during cooking will degrade the volatile oils. Adding ground cloves in the last 30 seconds of cooking, or to dishes that do not require heat at all, preserves the maximum amount of active compounds. Combining freshly ground cloves with other spices that have complementary bioactive properties, black pepper, cinnamon, ginger, creates a synergistic effect that enhances the bioavailability and anti-inflammatory impact of all of them simultaneously. There is one more practice I want to mention that is simple, free, and remarkably effective, and that is chewing on a whole clove. Not swallowing it immediately, but holding it in your mouth and gently working it with your teeth for several minutes. This releases eugenol directly into the oral mucosa, the lining of your mouth, which is highly permeable and allows for rapid absorption directly into the bloodstream, bypassing the digestive process entirely. This is actually one of the oldest traditional uses of cloves in virtually every culture that has used them medicinally. Chewing a clove for oral health, for toothache relief, for fresh breath, all of these traditional applications work precisely because of this direct mucosal absorption pathway. It is not a folk remedy. It is pharmacokinetics understood intuitively before the word pharmacokinetics existed. Think about what you now know that you did not know when you started watching this video. You know that the most potent compound in cloves, eugenol, is volatile, heat-sensitive, and easily destroyed by the most common preparation methods. You know that pre-ground clove powder loses its potency rapidly and should be replaced by fresh whole cloves ground immediately before use. You know that boiling destroys eugenol and should be replaced by a covered below boiling steep. You know that dairy can reduce absorption and that fat enhances it. You know that storage in sealed glass in a cool, dark place is essential for maintaining potency. And you know that the correct daily dose is modest, 1 to 2 cloves, consumed in a way that preserves and optimizes their remarkable bioactive content. This is exactly the kind of information that changes daily habits in small ways that compound into significant health differences over months and years. At Dr. Alex Morgan's Spoir Aging Wellness Lab, that is the mission. Not to give you dramatic overnight fixes, but to give you accurate, research-backed information that you can apply consistently and that genuinely moves the needle on how you feel and how your body functions as you age. Before you go, I want to ask you something. Drop a comment right now and tell me, were you making any of the mistakes we talked about today? Were you using pre-ground powder from a year-old jar? Were you boiling your cloves and wondering why you were not feeling much difference? Or is there a specific health benefit of cloves that you are most interested in? The blood sugar effect, the anti-inflammatory properties, the liver support? Tell me in the comments, because your responses genuinely help me understand what to go deeper on in future videos. And if you know someone who uses cloves regularly or who has been told by a family member to try them for their health, share this video with them. Because there is a real chance they are making the same mistakes and getting a fraction of the benefit they could be getting. This information deserves to reach as many people as possible, and sharing it costs you nothing. Subscribe if you have not yet, stay curious about your own health, and I will see you in the next video.